Telemedicine has been used for many years, and while the practice was primarily used by dermatologists and mental health professionals just a few short months ago, COVID-19 and social distancing have changed the way many healthcare professionals are currently treating their patients. Dr. Karen Edison, Senior Medical Director for the Missouri Telehealth Network and Show Me Echo, explains the benefits of virtual appointments and how to make the most of them.
Virtual visits, telemedicine can be used to contact your doctor or your other healthcare providers and tell them what your symptoms are or what your problem is, and they can interview you and maybe take care of it right there. They can potentially email prescriptions to your pharmacy, and maybe you wouldn't even have to go in to see the doctor in person. Since the pandemic, most doctors are using telemedicine. And I'm very hopeful that after this pandemic, doctors and other healthcare providers will recognize the power of using the technology to meet the health needs of their patients. Because many of our health problems can be cared for in this way. The best thing for us all to do is to contact our healthcare providers, contact your own doctor's office and ask, what kind of telemedicine are you using now for your patients? Because as I said earlier, most doctors are using telemedicine now. So your healthcare providers, your system might have, for example, a patient portal already for you to go to and talk to your doctor through that patient portal. Or maybe they've adopted something totally different and they can tell you what they're using. We're on Zoom right now, and there are Zoom licenses for healthcare that are quite secure. And so that's just one example. But your doctor's office can tell you what kind of telemedicine is available to you. It's also a good idea to check with your insurer to make sure they cover the telemedicine service. You know, in the telemedicine world, we say that the policies and regulations have gone 20 years in 1 month. So the federal government, the state government, and insurers have really loosened the rules and the policies around what can be done and what they will pay for, because they really want to encourage the use of telemedicine in this pandemic. Really preparing for that video visit is just the same as preparing for an in-person doctor's visit. It's very important to think about what you want to say, maybe even write down what your symptoms are. It's very important to bring a complete list of the medications you're taking, both those prescribed and those that are supplemental or that you get at a health food store. It's very important to make sure that you get all your questions answered. So maybe writing your questions down ahead of time is a good idea. There's some little tips and tricks to know when doing a video visit. It's good to have the light in front of you, not behind you. It's good to be fully there in the screen so that your doctor can see you and take care of you better. And so it's good to practice ahead of time to make sure it's easy to use for you.
You can find more information relating to telemedicine and how to prepare for your virtual visit on the American Academy of Dermatology's website at aad.org.